For me, I'm very much, I'm here's a problem. Let's take care of it. I have a solution for that.
Our goal when we opened was to provide the highest quality care that was possible at a price people could afford.
I literally talk to physicians daily. Kelly, I can't even log in to see my own billing. I have no idea what's going on. I get a report once a month and nobody can explain it to me. I make it a point to train the physicians how to go and pull their own report.
I'm going to be on the course reporting tomorrow afternoon.
You are?
I am. I'm going to follow Jordan Spieth and Will Zalatoris and Scotty Scheffler. I'm not really reporting, but I am going to go watch the course.
Probably drink a couple beers.
Yeah, I might have a beer or two tomorrow afternoon. I mean, that would make my commentary even better.
Well, hey, everybody. Welcome to this week's episode of the Cutting Edge Podcast. I am joined here by my esteemed colleague and co-host, Tyler Tallman.
I always blush when you say that. Esteemed.
Yeah, well, you should have been a judge. You know?
Why? A judge?
Your Honor. Your Honor, Your Honor.
Oh, okay.
No?
This is getting weird.
Yeah,
All right.
so, but I mean, you are smart enough to be an attorney and be a judge.
Well, thank you. I would say the same about you, but you're an expert in the healthcare space. So.
Well, yeah, that could have gone a lot of different ways, so I appreciate you keeping it professional.
Thank you.
But as we go forward with this week's podcast, so the podcast this week is highlighting a fairly new medical device company based out of Southern California called Subchondral Solutions. We actually have their CEO, Tom Kinder, joining us from Orange County, I believe. And yeah, we're going to have a really cool conversation because, man, this is one of those rapid growth, new technology companies in the surgical device space in orthopedics that there's always something new going on.
It'd be really cool if Tom would send some of that Southern California cool air
Oh, tell me about
over
it.
here to us folks in
Tell me
Texas
about
because
it.
we're
So-
about to melt.
Yeah, this is
It's not that cool today. It's 76.
Well, it's only about 25 degrees hotter here. So anyway, so before we get started, let's give a shout out to a few folks for helping us out with making this happen. So Texas Assist, Surgical Assist Staffing, great supporter from the beginning.
Moonshot Marketing.
Yeah, Moonshot Marketing
Jen
Group and
Eaton
Jen Eaton. That's right.
Team, they've been huge in helping us get out all of everything on the social media sphere, we'll call it.
Yeah, and then your group, the Carrington Group.
Yeah, the Carrington Group. We're a family office here in Dallas, full service family office in the consulting and advisory space. So,
Yep, and then we've also had some great help from Ortho Lone Star. So
let's not forget Texas Assist.
And we did say
CJ
Texas Assist at the beginning.
Your wonderful company.
Well, yeah,
Yeah.
I appreciate that. You know, this is not about me. This is about everybody else. So
I know, but you pay the bills. So.
we do pay the bills. So before we get started, you can find us several different ways. You can find us on LinkedIn, the Cutting Edge Podcast. You can find us on all of your various social media channels. So Facebook, Instagram, Twitter. You can also find us on our YouTube channel. I'd really encourage you to subscribe to our YouTube channel, the Cutting Edge Podcast. And that way you get to not just hear our beautiful voices, but you get to see everybody's beautiful faces too. So,
And we don't Snapchat or TikTok. So
that's right.
And if you're interested in that, this is probably not a good show for you.
All right. So without further ado, let's dive right into this. We got about 45 minutes to be able to cover some ground. So, Tom, welcome to the podcast. Thanks for joining us today.
Appreciate this great opportunity for us to talk a little bit about what we're doing.
Absolutely. So, Tom, before we really get started on the company, tell us a little bit about yourself and the role you play with the organization.
All right. Well, I've been a healthcare executive for 33 years now, in all aspects of healthcare. This is my first venture into orthopedic surgery. In the company Subchondral Solutions, I took over as CEO in August of 2019, and we've rapidly expanded into the marketplace and are on a good growth clip and adding a lot of the real important surgeons, key opinion leaders across the country on a daily basis almost.
That's pretty cool. So you and I have known each other, gosh, we're going on 14 years.
Yeah.
that we've known each other.
Right.
In prior history, you have medical device experience in your prior professional background, correct?
That is correct. Yeah. In 1989, I started with United States Surgical Corporation. Very fortunate to have started there. Their training program was world renowned. Back in those days, we actually could scrub in with the surgeons and not only provide verbal technical assistance, but we could actually
Man,
do some hands-on work with them.
that's wild.
Yeah, yeah, it was crazy. And you think about it from today's perspective, that's for sure.
Well, that's awesome. So, clearly that was probably one of the reasons that they recruited you, because you had a blend of, administrative and leadership experience, but you had in the trenches device experience too, which,
Right.
leads us to talking about the company, Subchondral Solutions. So maybe give us just a brief background on how the company formed and kind of bring us up to speed to where you are today.
Well, it's like a typical startup. It's an overnight success. The first patents were filed in 2012. So these things take some time. The company initially was formed by a surgeon who came up with the idea, partnered with an engineer, got the products, at least prototypes produced, enough to submit to FDA for clearance. And once that happened, then the company really formed. There's 4 co-founders, and I think that was formed in 2016. And through all the patent filings and the FDA clearance, they pretty much had run out of capital. So they brought me in as the CEO CEOs, that's one of their big responsibilities. So was able to bring in enough money to get us to market and build out the inventory and all the things necessary. We got into patients, and now it's rapidly expanding company with building out the infrastructure for the company.
Tom, I want to ask a couple of questions about that. I'm always interested in companies that are in growth mode and need some additional capital or a lot of capital to be able to cash flow and survive these growth periods. What is some of the leadership skills that you think that you possess, that you were able to bring to the table that they didn't already have, that allowed them that type of growth trajectory?
This is really important, is that we have experts in their particular fields, but everybody was in the same lane. And that really is what hurts a company at an early stage, is that if you don't have the people who have their core competence, whether it's engineering or medical or whether it's, financial officer, when those are all integrated, you can't really go anywhere. So the thing that I like to do is break the company down to its very basics and then build it up accordingly, using the human resources that I have at my disposal. And that really helps to clarify the picture. And then you start to build in and fill in those gaps. So back to your question on the funding, what you have to do with these investors is, typical investors, they love technology, but they invest in the people. So you have to give them a sense of confidence that, number one, you know what you're doing. Number two, if you don't, you're going to figure it out. Number three, you're going to stay with the project until it reaches its maturity. And those are key things. And you have to be able to demonstrate that you can bring in people. CJ was an example of, when we got to know each other, you got to bring in the right talent that can help carry you, to the heights that you're expecting.
Terrific.
So, Tom, you've been with Subchondral Solutions, a couple of years. You made mention that they basically have burned through all their capital just getting the product to market.
Yeah.
If you're comfortable, share a little bit about the journey that a medical device company goes through. Sure. From concept to FDA approval, and what that potentially costs.
Well, that's CJ, it's more than you think, and there's more steps than you might think. So, coming up with the idea and building the product, that prototype product is those are huge steps. But behind that, especially for a medical device, you have to go through every type of, your manufacturers have to be qualified. So the FDA has to go in and these guys have to have the right credentials. You have to be able to prove that the packaging is going to keep the product sterile. You have to go through all the sterile processes to show when you ship the product somewhere that, you know, you're not going to break sterility on that. You have to go through the filings for everything, you know, from the size of the box to the label to the indications for use. So if you make something, you have to have specific indications that that particular device is going to address. And those indications can be very narrow or they can be very broad. And obviously for a company, the broader the indications are, the more your market potential is, right? But at the same point, you've got to be really good at what it is you do. And so those are the things. And from that early stage, you know, just the filing of the patents, the filing for the FDA to make, you know, to get through those processes, the company before I came here had raised like $980,000, of which 700,000, like 760,000 had gone to legal. And that was the
Holy
patent
cow.
filings, that was the FDA clearance. So that's it. It's very costly to get to market. Now to get it fully to where we were in human doing actual surgery, it took about another 1.7 million to do that. So if you look all in over that period of time, you're looking at 2.6 to 2.8 million just to get to the first patient.
What about timing? I mean, is this like a 1 year process? Are you burning cash like throwing it in the fireplace? Or are we talking this is 3-4 years?
Yeah, you know, it's because of the state, you know, the stage we're in, it's always a cash flow issue because you have these big hits. You know, you have those legal expenses, you have the manufacturing and finished goods expenses, you have your clinical, you have to follow these for a long period of time. And that takes money to do that. So, you know, we're always burning through the cash. That's kind of the idea, is to get us to that certain point. Right now, roughly, we're burning about $150,000 in cash. And at this stage, we're actually doing pretty good. We're generating about $35,000 per month, and that continually grows. So our projected break even is in October of 2023. So it's a process.
No kidding. Wow. Well, tell us specifically, you know, we said the company's name, Subchondral Solutions, but the anchor product, let's talk about that anchor product and what it is and what it's intended to do in surgery.
Absolutely. So everybody knows somebody that's gone in for a knee scope, right? Or a shoulder scope or whatever the case may be. Most of those issues are related to cartilage, and cartilage is what covers the bone. All right. And so in a joint, when it's working together, there's cartilage in there that's protecting each end of the bone. What happens though is when there's some sort of trauma or just wear and tear, the bone beneath the cartilage is the subchondral bone. And what's critical about that is almost all of the pain that somebody has is generated from that bone. Okay. There's data now that's supporting that. And so it's relatively common knowledge, but no one has gone from addressing the bone first, moving it up to the cartilage. Most of the companies and technologies, there's been billions of dollars wasted on trying to figure out how to smooth that cartilage back out after there's been an injury. So if you look at us from a kind of a layman's term, we are rebar in the concrete. Okay, so that gives you a little bit of an overview of what it is we do. We are the only game in town on this. You know, we're patented 11 worldwide patents, so we're really well protected. And you know, the concept is a unique concept, but because of the literature, people really understand it. It's really a pretty straight shot once we get in front of the surgeons.
That's interesting. So, you know, obviously you guys are still a young company and still making introductions to the marketplace. You know, when you and I were communicating as we were setting up for today, you had shared that you had a webinar going on with 229 surgeons that were listening in this afternoon. So, you know, maybe let's flip the switch for a moment and talk about market development and business development.
Sure.
And kind of what you guys have been through. And I'm curious what the reception has been by the marketplace thus far.
Well, that number, that 229, CJ, that was a day or two ago. We're at 346 now. So
Holy smokes.
Just to give you an idea. So this space in the industry is very unique in that it's a lot of hand-to-hand combat. when the reps go into in with these orthopedic surgeons, they have a really long-term relationship with these surgeons. When things are happening in surgery, things are happening fast, and that rep needs to be able to anticipate things that are going to be happening, right? So one of our core marketing efforts is getting the right people in the OR representing our product. So that's one. Number two, for example, this weekend is a American Academy for Orthopedic Surgery. So it's a world-renowned conference. There's 10,000 surgeons that'll be there. So obviously, we're meeting with a lot of surgeons face-to-face. We're finding partners, bigger companies that we can partner with from a strategic perspective, where our product fits into their product portfolio, that they don't have anything to fill this need. So that's part of it. We do have a pretty active social media campaign that's going on. And obviously this all comes down to driving patients to the docs. So you've got to do one side with the docs, and then you got to get patients there. And so we have, when we're having patient testimonials where people are coming out of surgery and they're able to get back to activity very soon, that's really helpful in the social media approach. So those are really the things, because it's FDA controlled and it's a prescription that only a surgeon can use. You can't just go blast it like you could for a number of other products.
So, it's interesting. It leads me to really two questions. And one is, historically, orthopedic surgeons are very set in their ways, right? It's tried and true. So if it's not broken, don't fix it. So what's been Subchondral Solutions' method of attack to be able to get physicians to pick up their head? Because they've been, you mentioned the number of companies that have failed in trying to address this issue. So how do you get past that failure history? Yeah.
So I think that the recognition, CJ, is that they were approaching it top down. We're approaching it bottom up. So that's the one thing. Every one of the surgeons know what their success rates have been and their failure rates. And so what we go in right now and we know the data for the overall market. So we sit down with the surgeon and say, okay, your patients that fit into this category where you've done potentially a microfracture or an Oates type procedure, how long is that lasting for your patients, right? And so that's what we're looking to show them, that number one, the patient's pain relief soon, back to activity sooner, usually about half the time, and then the durability of the repair. And as the business you and I used to work in, all of this comes down to patient referrals to surgeons. A successful patient's going to point out that Dr. Smith is the best thing going. So there's a number of things that move along with that, and that's what the doctors are really looking for is treating their patients with the best technology and technique that they can make available.
You said worldwide patents. So where all is this solution being used in the medical space?
So interesting enough, the first patent was filed in Singapore, which is pretty funny when you think about all the places you could be. But it's only being used in the United States right now. But we have patents in China. We have it in every country in Europe. We have it in the Middle East. We have it all of Asia. So these patents are, some of them are technique patents. Some of them are specific to the device, to the apparatus. Let me think if there's any other aspect. That's pretty much the areas where the patents lie. Every one of these countries, obviously, they are their patent guidance, like ours is the United States patent, USPTO. Every country is a little bit different on that, so we've had to navigate those, and we have to look at prior art to get those patents. So, that's hopefully that answers your question, Chris.
Yeah. One of the things that I think about when I think about just whether it's a small company or a mid-sized company growing is always, when is the right time to take it from a domestic operation to a international operation? And I imagine, Tom, that you guys have got a pretty significant fleet of employees that are trying to make all the things that you just described happen. So what is the plan for global growth for you guys, and when is the right time to take it? How big does this thing have to get here for you to get comfortable in investing to take something overseas or to the international market?
It doesn't make sense for a company our size, Chris. What makes sense and what these technologies do is one of the big companies acquires it, and then they have the full regulatory. They have already the distribution system set up. They already have the people in the regulatory that get their what's equivalent to an FDA clearance. You know, in Europe it's a CE mark. If it's in Australia, it's a TGA. So they're much more prepared than we are. And the U.S. healthcare market is by far the most mature and the largest market. So success here usually indicates it's going to be successful in these other areas.
That's cool. You know, we were talking about kind of physicians and how they handle new product adoption. But let's talk about patients for a moment. So, you know, you mentioned earlier that one of the benefits of this product or this implant is that patients recover faster, right? They get back to their normal daily activities faster. So let's drill down into that a little bit. Talk about why that's the case.
Sure. Well, first of all, as we talked earlier, is pain generation is coming from the bone. And so that bone it becomes edemic. So that can mean that it's collapsed on itself. It can mean there are small fractures to regular fractures, whatever the case may be. So if you address that pain right away, the patients start to feel better, you know, a lot quicker. The key with this is at time zero. So at the time of surgery, you're seeing that response already. When this is put into the subchondral bone, your body, the body heals itself. So you right away start to see that bone remodeling through the blood and the metabolic response. So you see that right away. And so by decompressing that bone with the tools and the implant itself, that's when that starts to begin. So when that patient gets off the table, they feel better immediately than they did going into surgery. The recovery time, what's significant about this is because that process heals so fast that the docs are able to mobilize these patients, within a week to a week and a half. Do you mind if I give you an example of a recent patient?
100%. That'd be great. I was just going to ask you if you actually had a device. Like, is this an implant? Is this
yes?
You know, is this a gel? I mean, do you happen to have a physical?
It's a titanium implant, and it's coated with this biologic coverage. It's coated with hydroxyapatite. So not only when we're creating that opening into the bone, drilling that channel into the bone and causing the metabolic response, the bleeding and the bone marrow to transfer, the coating on this will accelerate that process. Okay, so that's super critical with this. There are some other areas of the body where there's been hydroxyapatite used on, you know, smaller like screws and so forth, and so it's really well understood. But the patient I want to tell you about, this gentleman's 64 years old, in decent shape. You know, he plays tennis, he plays golf and so forth. And, you know, his knee's been bothering him for a long time. And one of the areas that commonly affect people is the bone beneath your kneecap. You know, some of your listeners probably know what I'm talking about, where you're walking down the stairs and right behind your kneecap, it just throbs. So that's what he had. It's called the trochlea, and that's an area that he's had problems with for years. And that area, that specific area, there's really nothing a surgeon can do today that's going to give any sort of durability or even really relieve the pain, because it's a really hard location to get access to. So this patient, we end up putting 2 of our implants in this patient. So again, he's 64 years old. He comes back to the surgeon 3 weeks after the procedure. He's already riding a stationary bike. Now, most of these procedures, they're still fully on crutches. Okay, so this will give you a point of reference. So he does that. The doctor's going crazy because he shouldn't be that active so soon because he's worried that, you know, something could happen. Well, then the guy comes in for his in the 4th week. He's going through PT. The guy is already deadlifting. which is insane, right? That means you have to bend all the way down and bring the weight up. And then in week 5, he is squatting. So it's insane. So he's doing all types of the exercises where you have bands around your ankle and you're moving around. The guy's off the charts. And we can tell you about some other professional athletes that we've done and so forth. But this guy is really stands out.
Tom, I have to tell you, I'm really confused because, you said at the beginning, well, he's in pretty good shape. He plays golf and tennis, and we're both golfers here. And I'm thinking, CJ and I don't deadlift anything. We're not doing squats, so I'm a little bit confused. But that is amazing.
Well, maybe you're not. In the gym when I work twice a week, I am doing squats. So, maybe that's the difference.
That's the difference.
Well, I just find it fascinating. Do you have any visual representation of what this is? I mean, how big is it? Is it the size of a penny? Is it the size of a?
Do you mind if I grab my bag here?
Yeah, man, that'd be awesome.
Yeah, so this is going to be amazing. Everybody knows the size of their knee. And so when you see how small, these do range in size. They range in sizes from 4 millimeter to 10 millimeter. But the implant itself looks like a thimble. So this is the implant by itself. So can you see that okay?
Yeah.
All right.
Yeah, we definitely see
that. So what it is you can see this white area here. That is the hydroxyapatite. The metal is a titanium, which is really what, it's frequently used in healthcare. It's a tried and true. I mean, if you have a total joint, your hip or your knee, that's what's in there. But what I was talking about the bone marrow and metabolic communication, you can see the openings on the side here. So those are what allow the metabolic response to go into the channel to help grow this into the bone, so to speak. But one of the things here is these are threads, so it's kind of like a screw. Like if you took a thimble, put threads around it, that's what it is. It's something really simple, but it's that approach and identifying what that true cause of the pain is what really makes this special.
That's cool. One of the things that I think about from a healthcare administrator standpoint is cost and payer acceptance.
Yep.
Right. Because that's a balance that the materials manager at the surgery center or hospital has to play. So talk about that a little bit and what's going on there.
Yeah. So much of healthcare is driven by these national contracts. So in some cases, the hospitals are actually owned by these big contracts. Some cases are freestanding hospitals, but they buy off of these group purchasing organizations. So here we are, we're only 15 months out. And during that time, we've landed a Dignity contract. That's 580 hospitals across the country. Catholic Healthcare Initiative, that's over 300. We have the VA contract, which is hugely coveted. You got that patient population and that age range is perfect. We have Tenet, which, being there in Dallas, how important Tenet is. And that's, I think 30 states is where Tenet has facilities. So back to your question about, materials management, if you're on contract, that's one of the big things, right? That no matter what that pricing is, if it's on contract, then that's your first gate you have to go through. Then you have to look at, okay, by using this implant, what is that going to mean to the patient over time? Is that patient going to be healthy over time, get recovered quicker? That's one of the things that the guys look at. But this is a very expensive implant. This is about $4,000 at list price, and that compares to what a total joint costs. The idea, though, nobody wants a total joint. And so if this can do like it's been doing so far, it can delay the progression of osteoarthritis. This could be the difference between you having a healthy knee or a healthy shoulder or whatever at this point, and keep you from progressing to requiring a total joint.
So by definition, we're talking about knees naturally because that's the initial indication. But what have you seen from surgeons in the marketplace in terms of kind of what we call going off-label or off-label use, using it in different parts of the body?
Well, see, that's the cool thing about this. It's not limited by joint. It's any osteochondral space. So every one of your joints, I don't care if you're talking about your thumb, you're talking about your knee, you're talking about your shoulder, you're talking about your big toe, your ankle. Those are all osteochondral units. Okay, so we're not limited or not indicated for a specific joint. We're indicated for the subchondral bone. So that gives us wide open. I mean, wrists, whatever you want to talk about. We've done elbows. So we are in, we start off with the knee. Immediately we ended up going in, by the way, there's 3 compartments in the knee. There's the condyle, which is if you look at, if this is the bottom of your tibia, right? It has this kind of curvature here. You can feel it in your knee. And so the condyle is this area. Okay. So that we are doing surgery there. We're doing surgery on the kneecap. We're doing surgery on the trochlea, which is that area behind the knee. We're doing surgery in the shoulder. There's an area that surgeons can't get to and can't repair, very much like the trochlea. It's a Hill-Sachs lesion. We're doing that. We're doing it in the elbow, radiocapitella. So, if you have the elbow pain and you're having problems with clicking and so forth, we're doing that. Our single biggest procedure right now is actually in the big toe, which is really funny, but it's debilitating. Somebody with a bunion or whatever the case may be that's had that pain. That's where this is being used a lot. And then in the ankle and the talus. So we are not limited by by which joint, and so the off-label use is, we're not experiencing any of that because we can go pretty much any place in the body.
So I got a question.
To me, the scope is just so big; it's overwhelming.
Yeah,
how much opportunity there is out there.
So have you volunteered yourself to be a patient?
Well,
I know you got a bunch of bionic joints already, but you still got some left over, don't you?
Well, I don't know yet. So far so good on the other ones, but yeah, age 18 was my first scope when I played college football. 7 procedures of all those ones I mentioned that failed on me, fail on most patients. So 7 of those procedures, and then a total replacement of the knee at age 56. But CJ, when you and I worked together, I had a hip replacement done at 42 or 45. I can't remember exactly what year it was. So the whole idea with this is keeping somebody from progressing to that. If this would have been something that would have been available when I was 25 or something along those lines, I may have still progressed at some point for a total joint, but my quality of life during the time leading between that intervention into the potential total joint could have been so much better, because my activity's been limited incrementally by having these different procedures. So, and it could be at some point where this eliminates the need for that, depending on when that patient has surgery to repair it using our implant.
I mean, that's really interesting to me, Tyler, because the projections for total joint replacements in this country over the next 10 to 15 years, our medical community cannot serve that many patients based on the number of providers. And we don't have a huge boost of providers coming along that are going to go do total joints, right? I mean, it's actually, we're going to see provider headcount decrease. Yeah. So this is super compelling from the standpoint. Obviously, the payers, I would tend to think that the health systems and the payers really got to be listening, because cost containment and reducing overall outflow, that's a big challenge right now. It's a really big challenge.
Well, I think, at the hospital level, that surgery level, one of the big issues in orthopedic surgery is infection rates. And so when a total joint's being put in, I mean, it's carpentry, right? So the more damage you're doing to the bone, the more fragments that can get out into the sterile field, and that can lead to issues with that. So that is something to really be that we can promise that we're going to minimize the potential for infection.
So, one of the key questions I had written down to make sure I asked you today is, what's been the most surprising finding this company has gotten as you've gotten your feet under you? Like, what's kind of hit you that you didn't expect? CJ,
we have enough data, to get through the FDA. Okay, but a lot of that is fundamental things. Okay, that implant's not going to pull out of the tissue or whatever the case, or out of the bone, whatever the case. But what I've found so far is that the acceptance of this implant has been phenomenal without a big case study. So we were able to go in with our FDA clearance. So, and I should clarify this. So we have a 510K FDA clearance. What a 510K is it's based on predicate devices that are out there. So it doesn't require a full clinical study, okay, like you would have to if you were a drug or whatever. So their question is, what have I been surprised with? We don't have that kind of data. We have, okay, this is what our product was built on. Here's how our clearance came through, and here you go. And the acceptance and the adoption of this without having that clinical data has been phenomenal. Now, post-market now that we're on the market, we're capturing data. We're capturing, self-reported pain scoring. We have a whole host of things that we're following, so we'll have more data. But, for somebody, like you said, if somebody has a gold standard procedure that they're comfortable with, how do you get them to move away to something that, doesn't have as much history? That's what I've been surprised with. It's really been a quick uptake for a lot of these surgeons.
That's interesting. I also think about, when we talk peer-to-peer reference, usually it's a prominent hospital or prominent health system
Right.
that somebody goes, oh, okay, so Johns Hopkins is doing that, then I want to do that. Do you have that? Do you have some wins like that you'd be open to sharing?
Yeah, NYU, Stanford, Duke, University of Maryland. Those are some of our advisors come from those locations. Those are really big, well recognized. What we've also been able to do is bring in some really significant surgeons. Some of them are the surgeons for major sports teams, NBA teams and so forth. So that credibility is really strong and well earned from their perspective.
Yeah, I think that's interesting. You mentioned that your product's been used in some professional athletes already. What you don't have to share names, but what sports are we talking?
So, and I can share names.
Okay.
Brooke Sweat was the very first one, and she was really early on. She's one of the first 5 cases we did. And the interesting thing with that is that her agent had it on because she's an AVP, a professional sand volleyball player. She's also an Olympic. She won the bronze medal. Her and her partner won the bronze at Rio. And so very well known. So her agent's on a call. They have 5 of the who's who surgeons in the United States on this call, and so they all have her MRIs. They all have the information they need. So they go one by one on the docs saying, okay, here's what I would do for you. And we won out of that with all these other things that are so much better known than what we do. So fast forward this. So Brooke is again, she was prepping for the Olympic trials. And with it being delayed in Tokyo by 1 year, that helped her with this whole process. But she had the procedure, and within about 3 weeks, she's back in, starting her rehab. We have videos with her at 4 months where she's playing down in Qatar in a professional volleyball tournament. So that's the professional athlete. We have a couple of NFL guys that I can't talk about. And the NFL guys have all been knee related at this point.
Gotcha. You're just kind of shaking your head over here, Tyler. Listening to all this, what are you thinking?
I'm excited about this. I've got 4 rounds of competitive golf ahead of me starting tomorrow, and I may need one of these in every joint in my body come Sunday night. So.
Yeah.
Hey, Tyler, I'll send you one of these and you can just rub it on the joint that hurts. It's not going to make any difference, but maybe psychologically it does.
Yeah, I'll be the placebo for sure for your test. No, it's just amazing. I mean, every week we're just so lucky to have doctors and surgeons and folks like Tom that just we're heading in a really really awesome direction from a healthcare perspective and the technology that's out there and available to us. And I think about, you know, being a dad to a young one with another coming. I mean, they take care of themselves. I mean, they could live a long life on this earth. So, and I think the other part of this that's so cool is the quality of life piece. You know, it's one thing to go and fix something that you just have to fix because you don't have any other choice, but it's another thing to get it fixed and still maintain a great quality of life. And I think that's what's pretty neat about what they're doing is people are getting back on their feet and they're able to have a great quality of life.
Yeah, no, it's a cool deal. You know, I just go back, you know, Tom, my last question for you here is what excites you the most about where you've come from and where you're headed here?
You know, it's funny, CJ. It's very much like when you and I worked together. You know, that company was a garage startup. This one was beyond the garage, but not very much further. And you know, when you're blazing a trail, you're taking a totally different approach in an area that's already well recognized that there's a lot of problems, and you're able to make a difference. I think, Tyler, I want to add to your quality of life comment. You know, quality of life, obviously, we all are aspire to that. But as in the health system, in your journey throughout life, if that quality of life is not there, if you're not able to stay active, that causes a lot of other problems that can debilitate you. Whether it's a type 2 diabetes, hypertension, those types of things. So what we do are helping people stay active. So their quality of life is better, their overall health is better. So, you know, CJ, when everything comes down to it, when you know your patients are doing better for the efforts that you're putting in, that sort of, you know, gives you the full circle. You know, there's business in there that's all great and all that, but at the end of the day, that person that we serve that day is going to have a better life. And so that's what makes this thing probably the most impactful thing that it does for me.
Awesome. Well, so Tom, how can people find you? I mean, one of the things that I think about, because you're such an early stage entrant into the market, if somebody hears this and they walk into their surgeon's office and they go, I have no idea what that is. How does the surgeon find you? How can patients find you and start that referral process?
You know, the subchondral solutions.com is probably the best way, CJ. You know, if somebody who's on Instagram or on Facebook or on Twitter or whatever, they can find us that way if that's what they'd rather do. LinkedIn, almost every social platform we're on. But subchondralsolutions.com will provide not only information for the patient, it'll provide information for the doctor. And there's an area on the website that only the surgeons can see. And so they'll be able to see the full procedure. They'll see all the medical literature that supports the use of that. So that's probably the best to send them to the website.
I want to add, our producer Chris will put this website in an area that you can see it on YouTube, because I don't know if everybody else out there that's listening, they hear subchondral and they pause and go, sub what? And how do I spell that? So we'll make sure that we get that up so that folks know how to find it.
Absolutely. We greatly appreciate that.
Well, Tom, I can't thank you enough for making time for us, especially with AAOS upon you. I know that is an incredibly important conference for you, probably the pinnacle of your year in terms of having a chance to engage with the masses. Yeah. So this has been great. I've learned a bunch about it. You know, if I ever go down that road, this will be top of mind. You know, fortunately, my knees are pretty healthy right now, but that's not going to be that way forever.
Yeah.
Hey, you know, ideally we don't have any patients, CJ. We know that's not the case, but you know, that means people are healthy and enjoying their lives. So that's part of where our mission is if you do have the damage, let's get you back to work.
Terrific.
Well,
great
Tom,
meeting you, Tom.
Yeah, really appreciate you again.
Absolutely.
And we wish your organization the best of luck. We'll do all we can to share this story on our platforms, and we'll make sure we get it over to you guys too, so you can use it to share the story. But
that sounds great. Thank you so much for inviting me today. It was definitely enjoyable, and I appreciate it. Good luck to you, both of you.
All right. Thanks, Tom. Until next week, We appreciate you. Tune in, stay in touch with our social media channels to see what's on the docket next. Thanks all. Have a good day.